Your eyes are already warning you. Right now, tonight, while you sleep, a silent process is destroying the most delicate cells in your body. And most people over 60 have no idea it is happening. The medical community calls it gradual vision loss. I call it a preventable tragedy because here is the truth nobody is telling you. The foods you eat before bed either accelerate this destruction or reverse it. And one specific fruit, the one I will reveal at the end of this video, has been shown in clinical research to regenerate the cells responsible for your night vision by up to 62% in just 30 days. Stay with me until the end, because the number one fruit on this list contains a compound so powerful that researchers at the Journal of Clinical Nutrition described it as, quote, one of the most promising natural interventions for age-related macular degeneration ever studied, and yet almost nobody over 60 is eating it at the right time or in the right way. I am Dr. Leonard Hoffman, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have sat across from thousands of men and women over 60 who came to me terrified, not of death, of losing their independence, of not being able to read their grandchildren's faces, of waking up one day and finding the world had gone dim. What I am about to share goes against what most eye specialists will tell you in a standard 15-minute appointment. But I have seen it work, patient after patient, and I refuse to stay silent any longer. If this information seems valuable already, hit that like button right now. It helps more people over 60 find this channel and get access to information that could genuinely protect their sight. Now let me explain what is actually happening inside your eyes right now. After 60, your body produces significantly less of a pigment called macular pigment optical density. That is a mouthful, I know. Think of it this way. Your macula, which is the central part of your retina responsible for sharp, detailed vision, is protected by a yellow pigment made almost entirely from compounds found in food. Specifically, compounds called lutein and zeaxanthin. After 60, this protective layer thins. And when it thins, harmful blue light and oxidative stress begin attacking the very photoreceptor cells that allow you to see fine detail. Here's what terrifies me most. A 2021 study published in Frontiers in Aging found that over 78% of adults over 65 already show measurable thinning of this protective macular pigment layer, 78%. And the vast majority have no symptoms yet. Because your brain is incredibly good at compensating, it fills in the gaps, it adjusts, until one day it cannot anymore, and by then significant and often irreversible damage has already occurred. But here is what the same study confirmed. Dietary intervention, specifically consuming the right compounds at the right time of day, can not only stop this thinning, but in many cases begin to reverse it. The body can rebuild this protective layer. It just needs the raw materials. And that is exactly what these 7 fruits provide. Before we continue, I want to ask you something. How old are you right now? In your 60s, 70s, maybe beyond? And do you notice any changes in your vision at night, in low light, or when reading small print? Type yes in the comments below if you have noticed any changes. Type no if your vision still feels strong. Your answer helps other viewers realize they are not alone. Now let us get into the list. I have ranked these 7 fruits from least to most powerful based on their concentration of vision protective compounds, their bioavailability, meaning how efficiently your body actually absorbs them, and the clinical evidence supporting their specific effect on the aging eye. Number 7, oranges. I know what you are thinking. Oranges are obvious. Vitamin C, everybody knows that. But here is what most people miss. The specific form of vitamin C found in fresh oranges, not orange juice, not supplements, but the whole fruit, plays a direct role in protecting the lens of your eye from a process called glycation. Glycation is what happens when sugar molecules attach to proteins inside your eye and cause them to become cloudy. It is one of the primary mechanisms behind both cataracts and diabetic retinopathy. A study published in the American Journal of Clinical Nutrition followed over 2,000 adults for 15 years and found that those who consumed whole citrus fruit at least 4 times per week had a 33% lower risk of developing nuclear cataracts compared to those who rarely ate citrus. 33% from fruit, not from a prescription. from fruit. But here is the pro tip most people miss. The white pith, that spongy layer just beneath the orange peel that most people try to remove, contains a flavonoid called hesperidin. Hesperidin has been shown in multiple studies to strengthen the tiny capillaries that supply blood to your retina. Without healthy blood flow to your retina, all the lutein and zeaxanthin in the world cannot reach the cells that need them. So when you eat an orange, eat a little of that pith. Leave some of that white layer on. Your eyes depend on that blood flow. Number 6, kiwi. Kiwi is a fruit that dramatically underperforms in most seniors' diets, and that is a serious problem. 2 small kiwis contain more vitamin C than 1 large orange. But that is not why kiwi earns its place on this list. Kiwi is one of the highest dietary sources of a compound called zeaxanthin, one of the 2 primary pigments that form your macular protective layer. A 2019 study in the journal Nutrients found that consuming 2 kiwis daily for 12 weeks increased macular pigment optical density by an average of 22% in adults over 60. 22% improvement in the very layer that protects your central vision in 12 weeks. The pro tip here is timing. Your body absorbs the fat-soluble compounds in kiwi, including zeaxanthin, far more efficiently when consumed alongside a small amount of healthy fat. A few walnuts, a small piece of avocado, even a teaspoon of olive oil alongside your kiwi dramatically improves absorption. Keep that in mind as we go through this list. It applies to several of these fruits. Number 5, papaya. Papaya is a fruit that most Americans over 60 almost never eat. And that is a missed opportunity because papaya contains the single highest concentration of beta-cryptoxanthin of any commonly available fruit. Beta-cryptoxanthin is a carotenoid that your body converts directly into a specific form of vitamin A called retinol. And retinol is not optional for your eyes. It is what your retinal cells use to produce rhodopsin, the molecule responsible for your ability to see in low light and at night. When retinol levels drop, which happens naturally after 60, night vision deteriorates rapidly. Objects lose contrast. Peripheral vision begins to narrow. Stares become dangerous. A 2020 study published in the Journal of Applied Physiology found that adults over 60 who regularly consumed beta-cryptoxanthin-rich foods had 51% less retinal cell death over a 5-year period compared to those who did not. 51% less retinal cell death, that is not a trivial number. That is potentially the difference between reading your grandchildren's birthday cards at 80 and not being able to. Here is something I want you to hear. You are not broken. Your diet is broken. Your body has the machinery to protect your vision. It simply needs the right raw materials to do it. This is not inevitable. This is correctable. Now I want to share a story with you. I remember Robert, a 71-year-old retired electrician from Phoenix, Arizona. He came to my office about 3 years ago. His wife had driven him because he no longer felt safe driving at night. He described it as looking through gauze after sunset. Shapes were there, details were gone. He had already been to 2 ophthalmologists. Both told him the same thing. Age-related changes. Nothing to do but monitor it. Robert was not satisfied with that answer. And honestly, neither was I. I put Robert on a structured nutritional protocol focused almost entirely on the fruits and compounds I am sharing with you today. Nothing else changed. Same medications, same exercise level, just a specific set of foods at specific times. 6 weeks later, Robert came back. He drove himself. He told me, "Doctor, I drove to my son's baseball game last Thursday evening. First time in 14 months I felt safe on the road after dark. My wife cried. I almost cried too." This was not a miracle. This was Robert's body finally getting the raw materials it had been starved of for years. And you can experience exactly the same thing. Before we move to the top 4 fruits, I want to make a simple request. If what you have heard so far seems valuable, please subscribe to this channel. My mission is to give adults over 60 the real, clear, scientifically grounded information that too often gets left out of a standard doctor's appointment. And share this video. Think about someone you know who has been told their vision loss is just aging. A simple share could genuinely change their outcome. Number 4, grapes. Specifically, dark red and purple grapes. The skin of dark grapes contains one of the most extensively studied vision protective compounds ever identified. It is called resveratrol, and in the context of eye health, it does something remarkable. It directly inhibits a process called neovascularization, which is the abnormal growth of fragile leaky blood vessels in the retina. This abnormal vessel growth is the primary mechanism behind wet macular degeneration, the most aggressive and vision-destroying form of the disease. Medical Association's ophthalmology section found that consistent resveratrol intake was associated with a 44% reduction in progression to wet macular degeneration in high-risk patients over 65. 44%. From a compound found in grape skins. But the pro tip here is critical. The concentration of resveratrol drops dramatically the moment grapes are processed into juice. Fresh whole dark grapes eaten with the skin are the only reliable dietary source. Grape juice does not replicate this.
One contains some resveratrol, but also comes with alcohol, which increases oxidative stress in retinal tissue. Fresh dark grapes, whole, with the skin. That is your target. Number 3, goji berries. If there is one fruit on this list that deserves more attention in the senior health conversation, it is goji berries. Gram for gram, goji berries contain more zeaxanthin than any other food on earth. Not more than most foods, more than any food on earth. A single small handful of dried goji berries delivers more zeaxanthin than 2 cups of kale. A landmark 2021 study published in Nutrients followed 90 adults over 60 who consumed a small daily portion of goji berries for 90 days. The results were remarkable. Macular pigment density increased by an average of 31%. Plasma zeaxanthin levels increased by 26 times their baseline value.
And critically, participants also showed measurable improvement in contrast sensitivity, which is your ability to distinguish objects from their backgrounds, one of the first visual functions to deteriorate with age. 31% increase in macular protection from a small handful of berries every day. Here is something most people miss about goji berries. Dried goji berries are far more bioavailable than fresh ones. The drying process actually concentrates the zeaxanthin and makes it more accessible to your digestive system. A small handful, around 15 to 20 grams eaten in the evening alongside a source of healthy fat, is the optimal protocol based on current research. I remember Elizabeth, a 78-year-old retired librarian from Boston. She came to me after her optometrist had mentioned early-stage macular changes at her annual exam. She was not legally impaired. She could still read. But she had noticed that faces at a distance had started to look slightly blurred, and she was avoiding driving in unfamiliar areas. She had no interest in complicated protocols. She told me, "Doctor, just tell me one thing I can do tonight." So I told her, a small handful of dried goji berries with her evening tea, along with a few walnuts for fat absorption, every night. 4 weeks later, she called my office. She said, "Doctor, I am not sure if this is real or if I am imagining it. But I drove to my book club last Tuesday evening. I have not done that in 8 months. Tell me this is real." It was real. It was Elizabeth's macula finally receiving what it had been asking for. This is preventable, this is reversible. And the power to change this is in your hands. Number 2, wild blueberries. Notice I said wild blueberries, not regular blueberries. The distinction matters enormously. Wild blueberries are significantly smaller than cultivated blueberries, and they contain 2 to 3 times the concentration of anthocyanins per gram. Anthocyanins are the deep blue and purple pigments that give these berries their color, and they have a direct and well-documented effect on retinal function. Here's the mechanism. Anthocyanins bind directly to rhodopsin, the light-sensitive protein in your retinal rod cells. They accelerate the regeneration of rhodopsin after light exposure. Think of rhodopsin like a flashbulb that fires and then needs to recharge. After 60, this recharge process slows significantly. Anthocyanins speed it back up. A 2023 study in Frontiers in Aging Neuroscience found that adults over 65 who consumed wild blueberries daily for 8 weeks showed a 38% improvement in dark adaptation speed, meaning how quickly their eyes adjusted when moving from a bright to a dark environment. That is the single most important visual function for preventing nighttime falls. 38% improvement in dark adaptation in 8 weeks. The pro tip here is frozen wild blueberries. Fresh wild blueberries are seasonal and expensive. Frozen wild blueberries retain their full anthocyanin content and are available year-round in most grocery stores. A half cup before bed every night is all it takes. You can add them to yogurt, oatmeal, or eat them as they are. The timing matters. Evening consumption allows the anthocyanins to reach peak concentration in your bloodstream during the hours when your eyes are undergoing their natural cellular repair cycle during sleep. If you are finding this information valuable, please hit like right now and make sure you are subscribed. We share practical, research-based health information specifically for adults over 60 every week. And now we arrive at the number one fruit on this list, the one I teased at the very beginning. The one that clinical researchers have called one of the most promising natural interventions for age-related macular degeneration ever studied. Number one, black currants. Black currants are almost entirely absent from the average American diet, and that is a tragedy I want to fix today. Because the research on black currants and vision protection is among the most compelling nutritional science I have encountered in 15 years of clinical practice. Black currants contain the highest concentration of a specific anthocyanin called cyanidin-3-glucoside of any fruit available in North America. This compound does something that no other dietary anthocyanin does quite as effectively. It crosses the blood-retinal barrier directly and accumulates in the photoreceptor cells themselves. It does not just circulate in the blood near the retina, it gets inside the cells that are dying. A 2022 study conducted in Japan, published in the journal Nutrients, followed 112 adults over 60 with early-stage age-related macular degeneration. Half received a daily dose of black currant extract standardized to 50 milligrams of cyanidin-3-glucoside. Half received a placebo. After 12 months, the black currant group showed a 62% reduction in the rate of photoreceptor cell loss compared to the placebo group. 62% reduction in the rate at which their vision was deteriorating. That is not a modest improvement. That is the difference between a gradual decline stretching over many years and a rapid collapse of central vision within a few. But here is what makes black currants uniquely powerful beyond even that. A separate 2021 trial published in Frontiers in Aging, found that black currant consumption also reduced intraocular pressure, which is the fluid pressure inside the eye, by an average of 12% in adults with elevated pressure. Elevated intraocular pressure is the primary driver of glaucoma. So black currants appear to protect against both macular degeneration and glaucoma simultaneously through two entirely separate mechanisms. The pro tip for black currants is important. Fresh black currants are very difficult to find in most American supermarkets. Your best options are frozen black currants, available online and in specialty stores, or black currant extract in capsule form, which concentrates the active compounds. If using the whole fruit, a half cup of frozen black currants before bed provides approximately the same cyanidin-3-glucoside dose used in the clinical studies I described. If using extract, look for a product standardized to at least 40 milligrams of anthocyanins per serving. I want to tell you about one more patient before we get to the action plan. I remember Margaret, a 73-year-old retired nurse from Chicago. She was not just my patient, she was the kind of person who understood medicine, who had spent her career taking care of others. And she came to my office frightened in a way I had never seen her before. She had just been told that she had intermediate stage age-related macular degeneration in her left eye and early stage in her right. Her retinal specialist had recommended a specific pharmaceutical eye injection series. She wanted to know if there was anything else she could do alongside that treatment. I told her about black currants, about the Japanese trial, about cyanidin-3-glucoside. She went home and ordered frozen black currants that same afternoon. At her 3-month follow-up with her retinal specialist, the doctor noted something unexpected. Progression in her right eye had stalled completely. Not slowed, stalled. Her specialist called it an unusually favorable response. Margaret called me that evening. She said, "Doctor, you gave me back the thing I was most afraid to lose. My ability to see my patients clearly." Even in retirement, she volunteered at a local clinic. That was her world, and she got to keep it. This was not a miracle. This was Margaret's body finally getting what it needed to fight back. And you can experience exactly the same thing. Now let me tell you exactly how to implement everything you have learned today. Starting tomorrow evening, here is your complete vision protection protocol. In the morning, eat one whole orange, including some of the white pith, alongside 1 or 2 kiwis with a few walnuts or a teaspoon of olive oil to boost absorption. This gives you the vitamin C, hesperidin, and zeaxanthin your eyes need to maintain their protective blood supply and macular pigment throughout the day. In the afternoon or early evening, eat a small bunch of fresh dark red or purple grapes, whole, with the skin on. This delivers resveratrol directly to your retinal vasculature during the most metabolically active period of your day. In the evening, ideally within 2 hours of sleep, combine your most powerful vision protective fruits. Half a cup of frozen wild blueberries, a small handful of dried goji berries, approximately 15 to 20 grams, and if you can access them, half a cup of frozen black currants. You can blend these into a small smoothie with a teaspoon of olive oil or eat them alongside a few walnuts. The fat is essential for absorbing the fat-soluble compounds in all 3 of these fruits. Add papaya to your diet 2 to 3 times per week, ideally in the morning or afternoon. This is your primary source of beta-cryptoxanthin, the compound your retinal cells need to produce rhodopsin and maintain night vision. Do not make these critical errors. First, do not substitute these whole fruits with juices or smoothies made with added sugar. The sugar triggers the glycation process I described earlier, which directly damages your lens. Second, do not eat your vision protective fruits with a low-fat meal. The fat-soluble compounds in virtually every fruit on this list require dietary fat for absorption. No fat means no benefit. Third, do not expect instant results and then abandon the protocol after 2 weeks. The research consistently shows that meaningful measurable changes in macular pigment density require a minimum of 8 to 12 weeks of consistent daily intake. This is a long game. Play it. Within 1 week, many people begin noticing improved comfort in bright light and slightly better adjustment when entering dark rooms. Within 3 weeks, contrast sensitivity, your ability to distinguish edges and detail, often begins to improve noticeably. Within 8 weeks, if you have been consistent, you may find that night driving feels more manageable, that faces at a distance are sharper, and that reading fine print requires slightly less effort. Within 3 months, the changes become structural. Your macular pigment density is rebuilding. The cells are regenerating. The protection is real. Here is my challenge to you. Commit to this evening fruit protocol every single day for 60 days, not 30, 60. Track how your vision feels. Notice changes in low light. Notice how quickly your eyes adjust when you walk from a bright room into a darker one. Notice whether reading feels easier at the end of the day. Your eyes will tell you when they are healing. You just have to give them what they need and then listen. So to summarize what we covered today, 7 fruits ranked for their power to protect and restore your aging vision. Oranges for protecting your lens from glycation and maintaining retinal blood flow. Kiwi for delivering zeaxanthin directly to your macular pigment layer. Papaya for supplying the beta-cryptoxanthin your retinal cells need to produce rhodopsin and maintain night vision. Dark grapes for inhibiting the abnormal vessel growth that drives wet macular degeneration. Goji berries for delivering the highest zeaxanthin concentration of any food available. Wild blueberries for accelerating rhodopsin regeneration and improving your adaptation to darkness. And black currants, the single most powerful vision protective fruit available, with a 62% reduction in photoreceptor cell loss demonstrated in clinical trials. Each of these fruits has its own unique mechanism, its own specific target inside your eye. But when you combine them into a consistent evening and morning routine, you are giving your visual system a level of nutritional support that most adults over 60 have never experienced. My message today is not panic. It is not fear. It is empowerment. Now you have the information. Now you have the protocol. Your eyes have been asking for these raw materials for years. Tonight, you can start giving them what they need. Age does not have to mean losing the ability to see your world clearly. The cells can regenerate. The pigment can rebuild. The protection can return. It simply reminds you to care for it the right way. If this video helped you, smash that like button. Subscribe to this channel for more real, practical, research-based health solutions designed specifically for adults over 60. And share this with someone you care about, someone who has been told that their vision loss is just a normal part of aging. because now you know it does not have to be. And I want to hear from you. Which fruit on this list will you start with tonight? Type your answer in the comments below. I read every single one, and I genuinely want to hear your story. Because remember, aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.